talking on the topic, should African government invest in genomic surveillance to track spread and mutation of NTDs like schistosomiasis and leishmaniasis? This is group 2, the negative team. My name is Odekomi Hakim Adeshino. I'm from Nigeria. My friend is Ruben Ziragi Marcos, also a Nigerian. We are working together. Introduction. Neglected tropical disease like schistosomiasis and leishmaniasis are significant health challenge in Africa, and advanced genomic surveillance may not be the most practical investment for a resource-constrained African health system. Therefore, African governments should prioritize basic healthcare infrastructure over genomic surveillance for neglected tropical disease control. Rebuttal. What is genomic surveillance? It is the use of genomic sequencing to monitor pathogen spread, mutation, and resistance. Point number 1. Resource allocation and competing priority. Most African nations have limited health budget and basic needs like clean water, sanitation, and primary care should come first. Neglected tropical diseases are driven more by poverty and more poverty than genetics, and this should be targeted. That is the root cause, which is poverty, should be targeted, not genetics sequencing. Point number 2, high cost and sustainability challenges. Genomic surveillance requires high-tech infrastructure, training, data storage, and continuous funding, which many African countries cannot sustain. There is risk of becoming a donor dependent, and the project will be short-lived due to discontinuity. And genomic surveillance is therefore resource intensive and complex for low budget setting like Africa. Genomic surveillance requires expensive sequencing machine, maintenance, and trained staff, whereby Africa faces shortage in basic diagnostic tools and healthcare facility. For example, only 14% of African countries have advanced sequencing capacity, and high-tech solutions often derive from primary African needs. Point number 3, lack of immediate impact. In Africa, schistosomiasis and leishmaniasis control relies on mass drug administration and vector control, not genomics data. Unlike vaccination or vector control, genomic surveillance does not offer direct or fast relief for affected populations. People dying of worm infection may not benefit from long-term surveillance strategies. Therefore, genomic surveillance benefits are long-term, not addressing urgent needs. Point number 4, competing health priority due to financial constraints. Africa faces higher burden diseases like malaria and HIV demanding immediate resources. Example, malaria causes 600,000 deaths annually in Africa compared to fewer deaths from neglected tropical disease. This is WHO 2024. And resource allocation must be prioritized towards disease that has highest mortality. This diagram shows comparative disease burden in Africa. If you look at schistosomiasis, it has about 180 million cases, where malaria has about 203 million cases. And when you compare leishmaniasis, which has a disease burden of about 0.9 million cases, compared to HIV, which has about 25.6 million cases. Therefore, malaria and HIV should be prioritized. Point number 5, competing health priority due to financial constraint. Lack of trained personnel and reliable electricity hinders genomic program. Data sharing across Africa is not extensive due to political and logistical barriers. Therefore, genomic surveillance requires robust systems that many Africa lacks. High cost and sustainable challenges. Genomic surveillance require high-tech infrastructure, training data storage and continued finding. Many countries in Africa cannot sustain it, and there's a risk becoming donor dependent and making the project short-lived. Data ownership and exploitation risk. Without strict legal framework, genomic data may be misused by foreign researchers or corporations. African community might be studied without benefit from the results. These are the summary of my constructive arguments. Alternative investment prioritization. Clean water and sanitation can be used to prevent schistosomiasis, whereby insecticide-treated nets and diagnostics can be used to reduce the occurrence of leishmaniasis. And these two alternatives are more cost-effective and yield immediate results. And we can see that low cost and impacts of intervention should take precedence in resource-poor settings like Africa. Closing statement. Genomic surveillance is costly, complex, and less urgent than basic NTD control measures. African government should focus on proving affordability intervention. Effective neglected tropical disease control in Africa hinges on strengthening primary healthcare, not advancing genomics. These are my references. Thank you for listening.